Hello everyone. Today I want to share a little something with you guys, something completely different. I am not gonna talk about periodontal disease today, but I want to share that with you. So the sinus, everybody has sinus. You guys heard about sinus infection. So the sinus are actually very close to your teeth, or I would say your top teeth are sitting on the sinus. So when you have allergic reaction, lot of allergy, you might feel like your top teeth are hurting just because the sinus and the teeth are very close. So the root of the teeth are sitting inside the sinus. So some people, it goes so low that like half of their root is actually sitting in the sinus. So if you have sinus infection, you might think you have teeth problem. Just like if you have teeth problem, you might think you have sinus problem. So if you have a problem, you think it's sinus problem, you go to the doctor, they give you medication for sinus infection, and you take the medication, it never goes away, it's time for you to go see a dentist, because it might be a teeth problem. Because if you have an infection on your teeth and it's one of the top teeth, especially the back ones, so you might have you might think it's sinus problem. Okay, so it's very important because those two are so connected, and a lot of people don't know what's going on in their mouth. So those back teeth of the upper arch, your top teeth, all the back teeth are sitting the root is actually in the sinus. Some people, it barely touch it touches just like at 10%. Some people, it touch it at like a good 50%, 30%. And if you are one of those people where the sinus is really it just crossed by your back teeth, that's mean you can have one problem and you think it's another one, just like you can have the other one and it goes vice versa. So you can have the sinus problem and you think it's teeth problem, just like you can have teeth problem and you think it's sinus problem. And I actually questioned one of my specialist doctor at my job, the oral surgery. I asked him a couple questions before I do that video, and I asked him, what could happen if someone has a tooth problem or a sinus infection and they can't really tell which one is which. And he told me in that case, they will go and check the tooth, and the tooth might respond that there's a problem. And when they do the extraction, if the patient still have problem, at that point they're gonna do a sinus drift. So it's some type of surgery where they're gonna go on the sinus and clean the sinus out to help the patient. So it's very important that if you have problem with your sinus, you go you take it sinus, you see the doctor, your primary, and the problem never goes away. It's time for you to go see the dentist so that they can check to see if it's not a teeth problem. I actually have couple pictures at the end of the video where I circle where the sinus is, and so that you can understand what I'm telling you, because if you don't see it, you might asking yourself, what exactly am I talking about? Okay, so I would love for you guys to go and subscribe if you haven't do so that every time I post a video, you guys have a chance to see the next one. And have a wonderful day. Thank you.